In pediatrics, some babies could be protected early just because a parent noticed one small change. Today, I'll show you what your baby's head can tell you, what's normal, what's not, and exactly when to see a doctor. During my pediatric rotation, I kept seeing the same story. A baby had a sign that was visible early, but nobody knew it mattered. So today, I want to teach you how to read 3 things in a baby: head size, head shape, and the soft spot, also called the fontanelle. This video is not to frighten you. Most findings are normal, but if something is not normal, early action can truly protect the child. Quick note, this is education, not a diagnosis. If your baby is not acting normal, not feeding, very sleepy, vomiting repeatedly, or you're simply worried, trust your instinct and see a doctor urgently. Part 1, head size, what macrocephaly and microcephaly actually mean. Let's start with head size. We measure head circumference with a tape around the biggest part of the head, above the eyebrows and around the back. Then we compare it to standard growth charts for age and sex. If the head circumference is bigger than expected, we call it macrocephaly. If it's smaller than expected, we call it microcephaly. Here's the key message. It's not just the number today. What matters is the trend over time. So what should you do as a parent? First, make sure head circumference is measured at routine visits, especially in the first 2 years. Second, ask your doctor this exact question. Is my baby following their curve or crossing percentiles? Because yes, a baby can have a big head and be completely normal. Sometimes it's simply familial, but rapid growth or a head that suddenly starts jumping percentiles needs evaluation. Now, macrocephaly, what's common and what's urgent. One serious cause we worry about with a very large head is hydrocephalus, extra fluid in the brain spaces causing increased pressure. But you don't diagnose hydrocephalus by looking at the head alone. You look at the baby. So please see a doctor urgently if a large head comes with persistent vomiting, unusual sleepiness or difficulty waking, poor feeding, seizures, and one important sign, eyes that look pushed downward most of the time. People call it sunset eyes. Quick awareness point. Some children with autism can have a larger head circumference. But big head does not mean autism. Development matters more. If there are developmental concerns or loss of skills, talk to your pediatrician early. Part 2, the fontanelle, your baby's soft spot. Parents are often scared of it, but it's normal and it's there for a reason. Here is a very important point. The soft spot can look full when a baby is crying, straining, vomiting once, or lying flat. That alone does not mean danger. Also, gentle pulsations can be normal. It can synchronize with heartbeat and even breathing. That's normal. The best way to check the soft spot is when the baby is calm and in a more upright position. Now, bulging versus sunken, what to do? If the soft spot is sunken, the most common explanation is dehydration. Sometimes poor nutrition can contribute too. What should you check? Feeding, wet diapers, tears when crying, dry mouth. And if your baby has fewer wet diapers, is very sleepy, or cannot keep fluids down, see a doctor. If the soft spot is bulging and your baby is calm and upright, that can signal increased pressure. And it matters even more if there are symptoms like fever, vomiting, lethargy, seizures, extreme irritability, or stiff posture. Possible serious causes can include infections like meningitis or encephalitis. Again, remember this, crying or lying down can make it look fuller. Calm plus upright is the key check. Part 3, head shape, flat head versus craniosynostosis. This is the part parents notice most, head shape. A baby's skull has bones connected by sutures. Those sutures allow the head to grow. Sometimes babies develop flattening from position, especially if they spend long periods on their back and always turn their head to one side. That's called positional plagiocephaly. It's common and often improves with simple changes. But there's another condition called craniosynostosis, when one or more sutures close too early. That can change head shape in specific patterns and may need specialist assessment. Here's an easy way to think about it. Positional flattening usually develops gradually after birth, is linked to a preferred head position, and you often see improvement with repositioning in tummy time. Craniosynostosis more often looks more fixed and progressive, may have a ridge along a suture, and the shape looks constructed, not just flattened. But listen, you don't need to diagnose which one. Your job is to notice and bring it early. Now, prevention without guilt. Sleeping on the back is still the safest for sudden infant death risk, so we do not change that. But while your baby is awake and supervised, do tummy time every day. Start short and increase gradually. Alternate the direction your baby faces in the crib. Switch arms when feeding. And reduce long time in car seats or carriers when it's not necessary. If your baby always turns to one side or hates turning the other way, that can be torticollis, meaning tight neck muscles. The good news, it's treatable. Early physiotherapy helps a lot. One more thing, neck control. In early life, head control develops fast. Around 1 month, many babies on their tummy can briefly lift the head. Around 2 to 3 months, when held upright, the baby can keep the head steadier. A little wobble can be normal early on, but if by 3 to 4 months your baby has very poor head control, seems unusually floppy or unusually stiff, isn't meeting milestones, or loses skills, bring it up early. That's not about blame, that's about acting early. Let me finish with a simple guide. Go today, urgently, if you see bulging soft spot when calm and upright, fever with unusual sleepiness or severe irritability, repeated vomiting with lethargy, seizures, or rapid head growth crossing percentiles. If this helped you, share it with one parent, because sometimes one small observation changes a child's future.